Good evening and welcome to Bronx Talk. Diabetes is a significant public health crisis in the Bronx. Sadly, the Bronx has the highest rates of diagnosed diabetes and diabetes-related complications of any borough in New York City. In fact, some Bronx neighborhoods have diabetes rates that's been reported as high as 25%, 1 in 4. So tonight we brought two health officials on the program to answer the questions of why this is so, what they're working on to get Bronx people healthier, and how you and we all can find the necessary resources to keep ourselves and our families healthier. Please join me in welcoming a senior clinical advisor in the Bureau of Equitable Health Systems for the New York City Department of Health and Mental Hygiene, Dr. Bindu Babu. Dr. Babu, thank you for joining us.
Oh, thank you for having me.
And from Oak Street Health, a family medicine specialist, it is Marlen Martinez. Nice to see you, Ms. Martinez.
Likewise, thank you for having me.
Let's just start with you, Dr. Babu. Let's just talk about, maybe even define it. Let's pretend that nobody knows anything. What is diabetes? How do people get it? And what are the concerns at this point for the Department of Health?
So diabetes is a disorder, and to say it in a nutshell in a very classic manner is when you have high sugar that's not controlled in the blood system. So when you have that, we have to have means of trying to control the sugar and basically saying that you need to take medication, you need to do lifestyle changes to prevent it. Otherwise, it'll go into different complications. It's not as simple as just having a little bit of sugar in your blood. You know, it goes to complications because you're putting sugar in your organs, you're putting sugar in your brain, you're putting sugar all over your body, which
it really
is
absorbs everywhere.
And it deteriorates.
You know, we all eat sugar. I mean, how many times you go to Dunkin' Donuts or another donut shop and everybody loves a donut, but some people have a predilection toward it that other people don't have.
Well, yes, because you are not making the insulin, which is a hormone from the pancreas, to control your sugar. You're not having enough insulin. So what happens here is if you're taking the sugar and it's too high, this is going to affect different parts of your body, not only the chemistry, your organs, and eventually it deteriorates, and it's slow. It's not like an all-of-a-sudden factor that comes and hits you.
Just start coughing or something.
Exactly,
like that. Yeah.
Exactly.
And family history is a big thing too, right?
Yes.
In other words, if your parents or grandparents, whomever, had it, then maybe you.
Yes, it's highly likely that you will also have diabetes.
You know, one thing I do want to do right at the outset, because I did say at the top that the Bronx has had, you know, significant issues with it. So if we could show this table, you could see the New York City neighborhoods with the highest percent of adults with poorly controlled diabetes. The top 4, or I guess in some ways you'd say the bottom 4, are Hunts Point, and look at the percentages. The, you know, 18.2%, Fordham in the Bronx and Bronx Park, 17.4%, Highbridge and Morrisania, Crotona, Tremont, all in that high level in New York City. Very scary. You know, something that's interesting to me, which I hadn't thought of till literally this moment, you talked about family history being one of the indicators, one of the factors. Because so many people come from other countries, it's possible they are not as in touch with their families' histories of health situations, so they come here and stay in, when we love them and we welcome them in the Bronx, but they could have a family history they aren't aware of. I'm just guessing that that's an issue.
It can be. They could, you know, depending on their communication with the family, and also the relevance of how the importance is a factor. You know, people think of high sugar, which is very common, as a very insignificant disease, right? It's just high sugar, just, you know, either let me take some medication, let me take some shot, or I feel good, right? You don't feel the diabetes, which is where people kind of think
and then and this will be the last question for you. I do want to bring Ms. Martinez in.
Yeah.
And then how do you discover that you have it?
Well, first of all, you should go do a blood test and you check the hemoglobin A1C, which is a 3-month marker. And that level is, if it's over 6.5, you need to start medication. But most importantly is lifestyle change, right? It's prevention of diabetes. And that's an education on diabetes and how to prevent, how to control how to take care of your health and food choices.
There are fundamental things in healthcare, and one of them is a regular checkup. And during that regular
Yes.
checkup, whether it be 6 months or even a year, during that regular checkup, you get a blood test. And so even if you don't feel it or feel different, you can find out that you have a problem.
Well, yeah, first they would usually do a glucose test, and when the sugar test is high, then they would check the A1C to determine whether it's an actual disorder.
Right. Ms. Martinez, Oak Street Health has taken this very seriously in the Bronx. There are 5 centers for Oak Street: Parkchester, Soundview, Allerton, Simpson, and University Heights. Describe the unique programs and what you have seen, and how, frankly, an independent health organization has looked at this issue in the Bronx.
Okay, Oak Street Health has taken it very seriously because we cater to disenfranchised populations, and Oak Street Health has established in communities that historically has patients that have poor health outcomes.
And also,
Right.
even though it's the largest industry in the Bronx, many are underserved and don't have access.
Absolutely,
Yeah.
right? So what we do is, like, first of all, Oak Street is very special when it comes to providing care, because we don't have any time constraint on our patient. We don't give them specific time, like, right? We go by value care, so their health, the quality of health is important to us, right?
When you say you don't give them time frames, what are we
Okay, we
referring
give
to?
them, for example, we like to establish trust with our patients when they come in, right? Establishing trust actually allow the patient to verbalize and to be open to providers. Because when they come in, they're afraid to talk to providers. They're sometimes not receptive to what a provider is going to say, so they hold on to information.
I'm just guessing, and in some of the situations they'll come in and it's very it's difficult because there's a glass window and all that, and you really try to do this with people.
We try face to face, exactly, and we listen.
That's a checkbox for me. I like that.
We listen. So we start with giving them enough time to verbalize. It's not just clinical aspect of the medical problem that they do have. We actually listen to them when they come in. And we give them enough time to kind of verbalize. But as we take it seriously, we have behavioral health specialists as well. We have community health workers. We have social workers as well, because it encompasses a lot of stuff. You know, we have to know education is a key. They have to know what the disease process is all about as well.
And what you have suggested here is actually what Dr. Babu also touched on slightly, is that it's not only exactly what you eat, but the whole health of the holistic person is what's involved here. How they exercise, of course, the nutrition for what they eat, but other mental health aspects of it, so that you're treating not only diabetes but the whole health of a person, almost like this is an entree into a better, healthy person in general.
That's why Oak Street Health is so good, right? Because
Okay.
Oak Street Health,
I was making a guess and hoping I got it right, but I did.
we have an innovative care model, right? So when they come in, not only we go beyond typical primary care, right? We actually do a comprehensive preventive care. We have personalized wellness plan for the patient when they come in.
But before we even get into those specifics, what are the challenges in particular that you find that Bronx people face?
Access.
Access is a big thing.
Access is a big thing. We need to have access that they have access to healthy food. Can they afford it, right? A safe place to do exercise. Are they able to, are they living in a shelter? Where are they living? We need to find out, can they afford their medication? That's another thing.
And then that bridges into a question that we can't even deal with today, and that's about insurance and access to it.
Absolutely.
You mentioned about access to food, and I'm going to talk about my own neighborhood. I live in the Van Cortlandt Kingsbridge area where the Riverdale Diner used to be. I've just heard that they're taking out the Riverdale Diner and they're putting in a fast food chicken place. Right next door is Wendy's and McDonald's, and Burger King is a quarter of a mile away. who sat there and said, this is a good idea? I mean, I'm sorry, this is it's my community and it's a Bronx community. I just don't understand. That's the last thing we need. Imagine if we put a health food store there, or you know, Oak Street Health or the New York City Department of Health got a center there to really deal with these things. It really, you know, drives me nuts. Let's just talk about the access thing. So now you have the Tremont Center, right? And of course the hospitals, the public hospitals, Lincoln. And Jacoby and North Bronx Hospital. How do you help within those facilities to do the reach out and to make sure that people can have access to the kind of health care I'm not going to say need, they deserve?
We have programs that we're implementing in all the locations, and those are the diabetes self-management program.
Oh, I want to talk about that, yes.
Yeah, as well as the chronic disease, which is also the diabetic self-management program.
Right.
So this is where we're working with community health workers, certifying them, educating them on these programs that are CDC responsible programs, so that they can go along with community-based organizations, peer leaders, to really go into the communities at their level and their understanding.
It's a similar dialogue that I just heard.
And we're doing the program. So we launched it. It's been super successful. We have many people that come on board. We have different programs where we sit there and give them access to food. Like Bronx in specific has More Veggies program. I don't know if you know that.
I didn't.
Yeah,
I'm happy to know that.
Yeah, the More
Certainly
Veggies
given
program.
what we're talking
So
about.
right now we have 200 plus people who are enrolled in this program, where they're qualified to get fresh foods and vegetables in specific farmers markets, and they get a debit card, about $100 to $150 each, which they can use to get access to fresh foods and vegetables. Then you have Health Bucks, which is like these $2 coupons or checks that they can utilize in farmers markets. So we have different programs that are in place for healthy foods, farmers markets, educating community health workers, peer leaders, educating community-based organizations to really be boots on the ground.
There's two things that you said that occurred to me. Number one is the notion of farmers markets, and we have more of them than we used to, but this is a growing, bad pun, a growing concept in the Bronx. And you know, I talk to a lot of Bronx people, and when you talk to them and say, what do you want in your neighborhood? Is there any one of them that would say, nah, we don't want those farmers markets, you know? But this is how people get fresh food. The other thing I want to ask you is, you talked about they've been very successful. How do you measure that?
So we have statistics. We have certain classes that go on for about 8 weeks, which is about 2 hours each. Those who are enrolled and how they stay in those classes, right, to learn about self-management. And then we also, for example, the diabetes self-management program, we also check their weight, check their eating habits, support them as a lifestyle coach, not only just medical physicians or nurses or nurse practitioners. It's sitting with them, understanding, giving them the support, knowing that, listen, if you're trying to lose weight and you put someone in McDonald's and says, don't eat, it's very, very difficult.
Especially when they're running from place to place and they're hungry to get a quick bite because they got to run. They know this is reliable. It's there. It may not be healthy, but I got
it's affordable.
It's
right?
affordable.
It's affordable. That's a big one. So it's teaching them the mindset to reprogram how they can access food, different ways to do so, to plan a better plan for a healthier lifestyle.
I want to ask you, Ms. Martinez, about the notion of self-management. I'm assuming, based on the things you said, is that in addition to, you know, connecting with them, finding out where they're at, finding out what their challenges are, et cetera, then you want them to care for themselves.
Absolutely.
So how does that play at Oak Street, and how do you see it? Because it's a big educational piece in this.
It is. It is. But what I've noticed is that, you know, we cater more to like older adults, right? And then when the older adults come in, sometimes we have to bring in family members that can assist, the support system. So we actually wrap around and help them with that support, right?
Yeah, go ahead.
It's a team approach at Oak Street Health for us. The patients come in, they get evaluated, depending on the hemoglobin A1C. Like we implemented at Oak Street, this was generated, actually we started this program in Oak Street Soundview, with myself and a registered nurse, the Diabetic Protocol Management Graduation Program. So what we notice is
No, I like that, so I'm gonna pursue that in a moment. But finish what you're saying.
right? So no, we actually talk to them. Education is the key. If you don't know what the disease process is and how you can actually bring it down and what you can actually
How you can actually bring it
Yeah,
down, as
it-
opposed to saying, "Doc, give me a shot and I'll be done."
yeah,
for
Right.
the day."
no.
Right.
It's you have to do your due diligence and get involved. So we actually educate because you need to know what the disease process is. You also need to know potential complications
Right.
of that disease, right? So so
Yeah, I mean, I fully understand that. I'm going to ask you the same question that I asked Dr. Babu. How do you know it's successful? Do you see those kinds of things, or maybe that time to talk about graduation?
actually we do see when you see the hemoglobin A1C trending down.
Right.
And the patients are motivated, and the patients, you see them with the walker, literally doing, and they tell you, I walk around the block in my walker. So they're exercising, they're motivated to exercise. Or, I stop eating rice. I cut down on the bread. I'm not drinking juice, I'm
And
drinking
they
more
come
water.
back in and say that.
Absolutely, they keep their
Do
appointments.
you get tears in your eyes?
I get ecstatic.
Because that's wonderful.
That's wonderful, right?
I want you mentioned seniors, and I'm going to ask Dr. Babu in a moment. Is this problem more difficult for seniors who've lived their lives a whole one way, and now you're saying, well, change some of your lifestyle and behavior? Is it more challenging?
No, I don't think
You
so,
don't see it?
Gary. No, I don't see it because
I'm glad
because
to hear that.
because the amount
Personally, I'm glad to hear
no,
that.
I think they're afraid of the potential complications of
Yeah.
At that point,
diabetes,
wow,
right?
how interesting.
Right, I think that's it because they know that they can go blind. They know that there's
Yes.
going to be amputation.
yeah.
They know that they can end up on dialysis. So when you start talking about if it's uncontrolled and you don't get a hang of it, and I'm trying to help and assist, and I have a team effort of the whole clan here. We have community health worker, we have behavioral health specialists, we have medical assistant, we have nurses. So
Come in and see us.
right,
Yes.
right.
This brings up something that I talked about at the outset. Let's talk about the process that gets to a point where somebody needs an amputation. Is always because they're neglect, or is there sometimes it can't be helped?
No, it's usually because it's uncontrolled diabetes.
Because it's
the
been
sugar is super
uncontrolled.
high for a long period of time. And like I said earlier, it's unfortunate because when you have diabetes, like I remember most of the patients will come, I feel fine, doc. Why am I taking all this? I feel good. And people don't realize it's literally like if you have an apple and you have sugar on it and you make it sit for a couple of days, at first it's fine. Then later you see it slowly edging away. And you know when you feel it? When the apple breaks. So what happens to most people who have diabetes, they realize the toxicity of it when they go blind or when they lose the
goodness.
feelings of their fingers and then they have to amputate, or severe hypoglycemic shock or things like that. So hyperglycemia. So when it's unfortunate, and this is where education, awareness, understanding is important, especially for the youth, because when you're saying about the elderly,
Well,
or
that's
middle-
funny. I went the wrong direction
Yeah,
because you're
because-
saying young people are like,
Because they know the
fine.
possibility, right? They know this can happen. When you talk about 20s, 30s, they're like, oh, I have time. Oh, I can really focus on diabetes later if they're diabetes positive. But that's when you got to catch it. That's when you got to control
You
the
got to
lifestyle.
start from the pre-diabetes.
Yeah,
Right.
yeah.
The pre-diabetes level.
Right.
I'm just stepping back from everything I'm hearing. This gets back to what you folks said what we all agreed on in the beginning, the importance of general health care.
Absolutely.
Yes.
And I know a lot of times you get numbers and you say, okay, but those numbers, hemoglobin numbers and all that, you have to take seriously.
No, you do have to
absolutely.
take it seriously. You really do have to. And you have to start from the pre-diabetic level because you don't want to wait until you become diabetic.
You're trying to prevent that.
You prevent it. And that's why we have such a robust, comprehensive preventive care at Oak Street Health.
But you have to take that responsibility. You have to know that it's serious. If your A1C
Self-management.
is 6 and above or 5.9, you need to understand, okay, this is heading towards diabetes. Let me make some lifestyle changes. And it is tough. I mean, telling people to lose weight or change certain foods that they want to eat. But it's a matter of learning and understanding that you don't have to destroy your entire lifestyle. It's like instead of eating a whole mango, eat half.
Portion control.
Yeah, control what you're eating, control take baby steps at that time because it really goes a long way.
Ms. Martinez, if the population and everybody was perfect and had all the resources they needed to live, it might be easier to educate them, etc. Many people live in shelters or in transitional sort of home places. I don't even know how to ask the question. How do we reach them? Do you find they do come in? Or and she's nodding yes. You'll get it in a second. So no, but you could start and then go ahead.
They do.
That's
They
okay.
do. Healthcare, health insurance is also kind of like
Big thing.
a big thing. Health insurance is a big thing. People come in because they either start feeling sick. I have encountered people that go to urgent care or emergency room.
That's probably
know,
a way that they get it done.
And then they find out they're diabetic, but then they had never really got a primary care provider before, which is very important because primary
We
care
just said
provider,
that, yeah.
yeah, it's very important because primary care provider can be on top of it to be able to check.
And you know, just to talk about the whole spectrum of healthcare in the Bronx, people will go to one of these 24-hour places, so to speak.
Urgent care.
Urgent
Yeah.
care, and they will get notified, but they won't get the kind of treatment that both of you were talking about.
Well, you also have to understand you have community-based organizations. So people
yes,
who are
please,
in
let's
those
talk about that.
people who are in those places of homelessness, or they still go to their churches or their communities to get access to
That's
help,
true.
right? So they feel comfortable speaking to those people who are in their community base, who understand their level, to be private, to open up and say, listen, I don't feel good. It could be my sugar. And that's where they get access, right? Our department really supports that access through those community-based organizations or faith-based organizations with our CHWs to really get them the help and the support. So that's really important, especially in the borough of Bronx. It's being the boots on the ground in their level. It's not just a physician-patient access.
I'll ask both of you this: what about group situations? You talked about classes. People of the Bronx, they trust each other. They may not trust systems. They may not trust the doctors behind the mask or whatever, but they trust each other. I'm assuming if you can get people together sharing what they eat or their experience, or my cousin had it, or I'm concerned because my dad had it, or something like that.
Yeah,
That's effective.
Well, that's where the diabetic self-management program comes in, right? They come on weekly meets for 2 hours in discussion, and they also
How many
share.
people in the room?
Depending on who signs up. It could be from 15 to 20 to 8. There's really no limit. We welcome everybody. We try to facilitate as many we can. But it's more about them sharing their experiences as well. And it's very supportive, right? Like if today I'm having diabetes and I'm trying to do management and, okay, I goofed. I ate a piece of cake and I'm going to judge myself. But when you're sitting in a group and you hear someone, listen, I also couldn't help myself. If my friend's birthday, I ate too many tamales or something. And then you feel a little bit, okay, it's not just me. We're in it together and we can really support each other through its
And at
different
Oak Street,
lifestyle.
you run workshops of this nature.
We do. We do.
Describe them if you will.
The workshop.
I just want people to feel real comfortable about them. That's my thing. Go ahead.
We have activities. We have social gatherings where they can come in and, like you said, community. They join in and they have bingo games. We have
Really?
yeah.
Sorry, I didn't mean to laugh.
Arts and craft.
I want to join, right?
Yeah. We come
I'd like
together.
the time to sit and do that.
Yeah, and it's an opportunity to kind of talk about different topics, right? With the community. It's actually community.
You know, you started out by talking about, the whole person and keeping the whole person healthy. But you really do that in activities. It's not only doing that in verbally. In other words, by doing that, once you belong, you kind of belong, and then ultimately, presumably, as we saw in the graduation, that people come out healthier and come out, they feel better.
No, like I said.
Maybe you have more friends too. Go ahead.
No, it's a team effort. It's a team effort because physical and mental is also important, right? So community health worker, we have community health worker at Oak Street that can actually talk to those subsidized food banks and, you know, we can get SNAP programs in and, you know, to help them be able to
It's all
afford.
connected. It really is. And what I just
Yeah.
love, because, you know, people are so fragmented in the Bronx, et cetera. This really is a way of doing this. I do want to just talk about the Bronx Health Action Center, Health and Hospitals Lincoln are co-hosting MES, which is Diabetes Self-Management Educate and Support classes.
Yes.
So they're open to Lincoln patients and community members who get targeted outreach from Lincoln. Just talk about that briefly,
I
and
think
then we'll
that's-
put up contact because we want people to participate.
I think that's what we were discussing. You know, these programs that we're doing as a department is implemented in Lincoln. And that's exactly what I said, the community where we meet 2 hours in a week with the patients, and we really sit down and support them through their journey of lifestyle change for diabetes. How can they manage it on their own in a comfortable manner, in a supportive and motivational manner? And that's why we're all together, and it's a great, great program. And we have over 200 people listed, and they come every week and they
200
stay.
people. Oh, so that I didn't realize that was
Plus,
the
yeah.
program. Wow,
Yeah.
that's
And-
a lot of people.
Yeah, and it's doing great in the Bronx, and we're really, really happy about it. So hopefully we can expand further.
I was going to say I
And
don't
have a
want to
better
get
reach.
political with it, but if there's more funding, you can do more with it, right?
Well, sure.
Obviously. Okay, so the email for it is the Bronx Action Center at health.nyc.gov, or you can call 347-665-0213. We'll give Oak Street Health the last word. What is your message to the people of the Bronx who say, I don't know, I want to deal with this, what should I do? I sure want that other donut. I want that chocolate cream. Go ahead.
No, it's important to seek primary care. It's important to have your primary care provider.
Because it really starts there.
It starts there, you know, to get the complete physical, you know, acknowledged. If you are pre-diabetic, start from the start. Exercising, knowledge is power. Learn all about the disease process, how you can prevent it. You know, we can connect you to access for healthy food. You know, if it's behavioral, changing behavior is important. Losing weight is important. So,
And I'll just add one last thing, and then thank you both. When you walk into a health facility, Oak Street Health, et cetera, make sure you know, because you want the full care. It's not like you
Yes.
want this. Dr. Bindu Babu, thank you so much for joining us.
Thank
and
you
say
for
hello
having
to all
me.
our buddies downtown at the
I
Department of
will,
Health.
I will.
And Marlen Martinez, please keep taking care of the people of the Bronx.
pleasure to do so. And thank
you.
you for having us.
That will conclude tonight's program. We want to thank producer Rebecca Hemmick, our BronxNet production and editing crew, and mostly, and you could tell from this program, it's about you, the people of the Bronx. We'll see you next week. Good night. Stay there.